Okay. I'm just waiting for Pamela here. At least the live started this week, so we're already a step ahead, a step better than we were last week. But I'm super excited to talk about first trimester massage. This is a really important topic. I think last week's topic was also quite important. And let me see if I can get Pamela in here. Let's see. On video. Okay. It's asking me to send you a request, Pamela. Oh no, now it says it's adding. Okay. We did it. We did it, and we're not late today, I don't think. I think it's
4:01.
Okay, we'll take it. It's an improvement. Every week is an improvement. That's what we want.
Okay.
Oh my goodness. Hi.
Yes. Hello, how are you?
I'm good. How are you doing?
Good, good. Happy Friday.
Happy Friday. Happy
Yeah.
Friday. Oh my goodness. I swear, I'm always excited for the conversation. I'm just always
Me
like,
too.
please, tech, just behave.
Well, yeah, it's interesting. I mean, anyway, we're here. We got here today.
We did it.
Yeah, thank you.
Awesome. Beautiful. Well, I think, last week we covered, a big topic of induction massage.
We did.
And I feel like this week, this topic is also big. It's, I think, misunderstood a lot in our industry, and first trimester massage is often avoided. Women are literally turned away for care on a regular basis. And so I think it's really worthwhile chatting about.
Yeah, it's so important because, I mean, right, women need care, and the big companies, the big chain places just have a standard policy of not seeing women in their first trimester with no exceptions. So I think this is where our work and the training that we do, and really teaching and educating therapists about why and how to safely massage women in the first trimester, is so important. And the more we educate people about it, the more they can educate everyone out there about it and get rid of some of that disinformation. Yeah.
100%. Yeah. And myths. Yeah. So maybe we can just get into like, why would we want to do massage in the first trimester?
Yeah.
One of the things that I always talk to my therapist about and my clients is that the research says that stress actually tends to decrease over the course of a pregnancy. And so that means that this woman who maybe has just discovered that she's pregnant, she might be more prone to stress, and she's also dealing, like, she hasn't fully maybe necessarily integrated the fact that her life is changing, whether it's her first baby, whether it's, a subsequent baby. Every baby can change the course of a woman's life, the course of a family's life. And so I think that we do women a huge disservice by turning them away or not acknowledging that something huge has happened in their world, even though it may not be visually obvious that that they're pregnant yet. So that's one reason.
Yeah, I certainly know that I was more stressed in the beginning of all of my pregnancies than I was at the end or in the middle or any other time, and especially with that first pregnancy.
Agreed.
Most women, not many pregnancies are actually planned, right? So that just turns your whole world upside down. And
Yeah,
and the level of stress hormones on top of your pregnancy hormones makes for a very unpleasant hormone soup sometimes, that
yeah.
you know they need to have some comfort, and like you said, being validated and acknowledged. Yeah.
just being validated, right? Because it's not just most other massage places that will turn them away, but there are even, I have clients all the time that says my OB won't even see me yet until I'm 8, 9 weeks, usually somewhere right in
Just
there. But you know,
yeah.
those
Yeah,
couple of
and
weeks of being in limbo and not, nobody will acknowledge that this is going on with me. Nobody will help me. Nobody will even say like this is real, and we can be
yeah,
a sanctuary for that.
absolutely. And so many women fall through the cracks in that time period. I understand that the big, again, the big practices and those OBs, you know, there's a certain amount of miscarriages that are going to happen, and I think we have to acknowledge that.
Yeah.
But again, we can be, you know, a refuge for those women just to have, again, a safe space, right? And we'll talk more about that, I know, later today. But yeah,
A
yeah,
100%. Yeah. And this is, you know, this is the full spectrum of care, you know,
yeah,
that we can be there for women, you know, who miscarry and then get pregnant again and then maybe have fertility
absolutely.
struggles. And, you know, it's one big continuum sometimes. And so really having skill set and having like the big overarching view of how can we show up no matter what is being presented
Yeah.
in this season of life, I think is beautiful.
Yeah, I just wanted to kind of really give that some weight as well, that it is a circle, and that's the maternal model of care.
Yeah.
It's not a patriarchal viewpoint where it's very black and white and linear. What we're doing is very much encompassing ebbs and flows of our lives, you know, and
Yeah.
those are, you know, we don't acknowledge those like little, I should say little deaths, but those little things that happen each season that, you know, we do come out of things, and we, you know, come back into the spring of blossoming and pregnant again. And, you know, whether that's just the end of a full-term pregnancy and a birth, acknowledging that this is a cycle that we've finished and completed. So, yeah,
Completely. And I think that there's so much that can be said about being able to walk that path with a client, you know, and be there for all these different seasons, and the amount of trust and bonding that can happen in that time, I think is very, for me, it's deeply fulfilling. And I think for the clients as well, it's deeply meaningful. They don't forget these things.
yeah.
Yeah.
Yeah, and we do, again, we've talked about this before, but we get so much time with them, one-on-one time with them. And, you know, those postpartum people that come back in, you get to say, you know, how is everybody? And they, you know, we have history with clients. So, all right, fun little, I
Yeah.
deviated, but
Yeah. Well, and I was
but
going to say the
okay.
other, you know, the other very like concrete, tangible reason to be thinking about doing first trimester massage is that lots of women are coming into their pregnancies with pre-existing chronic tension, you know, and imagine if
Yeah.
we can get some of that taken off before it's compounded by, you know, the extra weight and the extra fluid of later pregnancy.
Yes, absolutely. I mean, from accidents and surgeries and just life, right? Sitting at a desk and all
Yeah.
those things be addressed right away. Like you said, yeah, yeah.
Yeah.
And I was working with an early mama this morning, and just teaching her to do pelvic tilts before she
Mhm.
gets, you know, way into her pregnancy, and then it's much harder to get the kinesthetic awareness sometimes, and it feels
Yeah.
really uncomfortable. You know, one of the things we do is teach good structure, you know, alignment, and I try and grab them really early to do that work, so it helps them all the way through.
100%.
Yeah.
And I mean, not only, like you said, starting early on helps, you know, just the entire course of their pregnancy, but it also literally helps them maintain that brain body connection of how do I even
Yeah.
access my psoas? It can be easier to do it earlier on. So,
Absolutely. Yeah. Yeah. So once that, yeah, the brain has made the connection with the muscle, then it's already there and it is easier. Yeah.
yeah, and then you're
Yeah.
just flexing it, maintaining it, and that's great. I'm so glad that you got to do that with her. And how far along was she?
So she was 17 weeks, which isn't super early, but before, you know, she gets further into this pregnancy, and um, she just, you know, some women have more body awareness than others and
Of
are more
course. Yeah.
connected, right, to their
Yeah.
pelvis and what they're feeling and where, where they are spatially.
Yeah.
And this was someone who needed just a little extra awareness. And, when she was turning over and I was asking her to maybe go back, hands and knees and go back into child's pose, no clue. She
Yeah.
wasn't ready to do it. So that prompted the
Yeah.
pelvic. So, yeah.
It's beautiful. And I was going to
Mhm.
say, 17 weeks is great to be on your table too, because
Mhm.
I still find that it's hard sometimes to get women in even, before 20 weeks.
Yeah. I mean, that is very true. I have the occasional person who comes in at like 8 weeks and knows they're pregnant, but it's not often, right?
Yeah.
Because there's so much going on. Maybe they're not sure. Maybe they don't know that they can come in for body work.
I think
They're,
so much of it is that they don't know, because I was going to say I have
yeah.
lots of second time clients, who have been on the journey with us before and then they know that to come back. But those first time clients, I often find it hard. I don't see them often coming in on of their own accord, usually before 20
Mhm.
weeks, unless, and it's unless like we're talking to them ahead of time. Like there's plenty of women that say, I'm only so and so. I know I probably have to wait, and I'm like, actually, you don't. You're welcome to come in
Yeah.
whenever you like, but here are some benefits of coming in early. I'm like, it's emotionally. Very nourishing. We can work on any pre-existing pregnancy stuff. Pre-existing chronic tension that you're holding. You can start to build relationships with the therapists on our team that you might like, that you might want to travel with through your pregnancy. And again, I try not to push them, but I just want them to know that it's available and that it can be very um, just nurturing for their whole journey, and that somebody can walk with them. And I think, like you said, like especially if somebody's having
Mm-hmm.
more traditional OB care where they're getting, maybe 15, 20 minutes, having somebody like us in their corner can really fill in a huge gap in their care.
Mhm.
Yeah.
Yeah. Yes, absolutely. So often, they start asking questions as they're decompressing, right? They'll start
Yeah.
asking the questions about, whatever it is, the doula care or um, postpartum, whatever, all the things, right?
So
Breastfeeding. I
many
mean, all the things.
things. Yeah.
So,
So many things. I know. And it's
yeah.
beautiful to be able to have that time to spend with them.
Yeah.
Um, so do you want to talk a little bit about positioning? Shall we segue into that
Yes.
for first trimester? Um,
Yes. Yeah.
so
I, I'm going to grab a
oh yeah, you're gonna
little
guard the
toy here
pelvis?
for
Okay,
us.
great.
Yeah.
Yes, I was gonna say the first thing that I wanted to just mention is that when we're talking about positioning in first trimester, this is really gonna only apply for singleton pregnancies, because if you have a mom of multiples, then that pregnancy you want to envision her as being almost a trimester ahead in her care. So if you
Mhm.
even have a mom with twins who you're seeing in her first trimester, you're going to just imagine that she's already in second trimester and treat her as such, because the body is accommodating multiple babies and the uterus is growing at an above average rate. So
Yes.
so
Yes.
just wanted to
Yes.
say that what we're going to talk about now is relative to singleton pregnancies.
Yeah. Yeah. So, here's my trusty pelvis. You guys can see, and so jump in anytime, Sparrow. But the front of the ASIS bones here are the body's so wonderful, right? These bones are designed to protect all this soft, visceral, these organs. And so same is true for the uterus growing, right? If the uterus is in here growing, and uh, my rule of thumb, and I think Sparrow's as well, is when we're positioning somebody prone in early pregnancy, if the uterus is already past um, interior of these ASIS bones, then I'm not as likely to put her prone, right? And so for most women, that happens pretty darn quick. I mean, if you even feel down now and feel where your belly comes out from your lower abdomen, most of us are already past those bones,
I
right?
was,
So if you put,
yeah,
yeah,
I was gonna say even me not
go ahead.
pregnant. just the way my how pronounced my ASIS is on both sides, it's not that pronounced. So my
Right.
belly, even non-pregnant, would be catching most of the weight in prone and not my bony structure. But there are some women where it could still be appropriate for them to lay prone because of their
Yeah.
unique anatomy. And that's what we need to be assessing as practitioners. Is it appropriate to be putting this client in prone? And it's not necessarily based on how far along she is or anything. It's very much, we have to assess like her individual anatomy and see if that's going to be a good fit for her or not. And I think you and I both, Pamela, we very much prefer sidelining, even in first
Yes,
trimester. Would you agree? Yeah.
absolutely. And the other thing is, yeah, if this is a mom, even if it's her, in pregnancy, the uterus is already going to be a little more pronounced than it would have been the first pregnancy. And so,
Yeah.
yeah, I very rarely put anyone prone during pregnancy. Now, if I have someone who really requests it and they are in that first trimester, I do have the body cushion system, and that
Mhm.
does create a little bit of space. And so I may, if she's sick pregnant, yeah, I will do that on occasion, but I definitely prefer to go into sideline with them right away. Hmm.
Yeah. And I think that there are some benefits to that. And we probably need to do an entire, talk just
Yeah.
about prone versus side lying, which will be another
Hmm.
great topic. But I think for at least right now, I just want to give context to it's not necessarily a probability, but it is at least a possibility that when you have a pregnant client laying prone, that there's the potential to create intrauterine pressure between the table here,
Yeah.
the baby in the uterus in the center, and then your hands and your pressure on top as creating
Right.
some level of intrauterine pressure. So that's what we're trying to be
Yeah.
mindful of. And
And
we
to
don't have
think
to worry
about,
about that at all in side lying.
right. And we need to think about that, inferior vena cava traveling down, right, the right
Mhm.
side of the spine
Can you
underneath the
lift it up
weight
just a
of the
little higher,
uterus.
Pam?
Yes. Can you
Yeah.
see?
Yes. Yes.
Okay. So, so yeah, if you think about that vessel traveling down through there and providing blood
Yeah.
to the uterus, if there's a lot of weight there, in prone,
Mhm.
then, there is a possibility of creating that intrauterine pressure. So,
Yeah.
yeah. Can you
Yeah.
see?
Yes, it's great. Yeah, beautiful visual. Love it.
Yeah. Yeah. So I
Um,
have a little placenta here too. We can dump our little placenta on
oh,
there.
you got a great placenta. I love it. Yeah.
There she goes.
Yeah, so that's great, but that's something that we just want to be mindful of, and that's the beauty of side lying is that really takes that out of the equation. So we don't have really any worry about creating that potential for pressure. And then the other thing that side lying does is it's literally putting a woman into a fetal position, right? She's going to have that
Mhm.
C
Yeah.
curve in her body, and that's going to be instantaneously just supportive to the whole nervous system.
Yeah, yeah. There's some studies that show that it definitely promotes parasympathetic response, just being in fetal position, right?
Yeah.
So,
Yeah, and
yeah.
especially if,
Um,
if stress is part of one of the main goals of helping in first trimester, just positioning alone that can soothe the nervous system can be so powerful.
yeah, absolutely. And it gives us a really great way to facilitate conversation too, if she chooses to do so. Not that
Yeah.
we're trying to have conversation, but if she wants to, just have that open dialogue, it makes it much more accessible.
100%. Yeah. Yeah, and I always try and follow my client's lead, but sometimes that is part of what they need. Sometimes even in just like the first little bit of the massage, and then once they kind of like clear everything off of their mental plate,
Yes.
then they can really drop into their body, into their breath, and it's beautiful to watch and to facilitate that.
Yeah, absolutely. Hmm.
Um, what else was I going to say about that? I guess we could talk a little bit about supine. Again,
Hmm.
like I think that side lying is great for everything, even, neck work, even if you need to like maybe get a little bit more practice with it. But I know that there are some therapists who really prefer to do their neck work in supine, and that is usually fine in first trimester, and potentially all the way up to 22 weeks if you put a wedge under your client's right side, and that is to shift the weight of the growing uterus and baby and fluid off of that vena cava that that Pam was just showing.
Yeah, that little wedge can literally be like a little rolled towel, right? Or just something will have to be, and you don't want it to be a great big thing to roll them too much, but you just want to take the pressure off. Yeah, so again, there's the weight of the uterus, and then the baby, and then there's a lot of weight hanging out there on that vessel. So we want to create as much space for them as possible.
Yeah. Yeah, and again, so much neck work can be done inside lying, because the other thing is that even if it's just a little bit of a wedge or a rolled towel or something, there is going to be a little bit of asymmetry in the body, and that's the point of doing it, right? Because you need that asymmetry to protect that vessel, but in comparison to just working in sideline, you're going to be very evenly and comfortably positioned. So as you can tell, we have a little bit of a bias towards sideline, but
well, and the techniques are so beautiful and functional, and they're good. It's good for I do a lot of work in sideline, not just my pregnant clients. So
yeah. I mean, I love receiving in sideline too. And it is, it is a little bit of a flex, to get your body mechanics as a therapist down, to be able to confidently orient to your clients, in that sideline positioning. But yeah, once you got it, it becomes second nature, and there's so many beautiful benefits for any client in any stage of life. Yeah. So let's talk a little bit about, well, actually, sorry, the last thing that I wanted to say just about side lying in particular is that the sideline positioning is actually an acknowledgement of her pregnancy in and of itself, right? Because most women are never going to have never usually been in side lying, and they're going to come in and they're going to say, oh my gosh, you'll see me during this time. Great. Oh my gosh, you're going to position me especially because you're acknowledging that my pregnancy is real, right? And that is, I feel like just that alone can be really comforting to a lot of clients.
Yeah, I mean, and I'm sure you guys hear it too, but one of the things I hear so often is that therapists just didn't know how to position me, properly on the table, or they only had a couple pillows, and women aren't comfortable like that. So,
no, and in fact, they have to kind of hold themselves up, which is not conducive at all to relaxation.
And we want to keep, mom and baby really safe, and that's the other thing. So,
yeah. And then, do you want to talk about some of the techniques that do you alter anything for first trimester in terms of the hands-on work? Do you want to speak to that at all?
For sure. The big thing that gets altered on my end, for us doing the pre and perinatal massage work from Carole, is the rhythmic rocking if she's having some nausea. Of course, if there's, she's having a lot of nausea, we don't want to induce that or make it worse. So I really check in about that. And then, those rocking movements. So I would do the technique without the rock. And then, there's some other precautions on the lower body for the medial leg that we wanted thinking about.
Yeah, but that's there for all pregnancy, right? So that's not necessarily.
Yeah, for sure. Yeah. Those are the two things that come to mind right away, though. For the other thing that can actually be, is the breast tenderness in the first trimester can be more pronounced. Yeah.
Which is another reason why side lying is great, because there's zero pressure on breast tissue.
Yeah.
And then, do you include abdominal work in first trimester?
I do not. Usually don't do any abdominal work in the trimester.
Yeah,
Yeah.
neither do we. Yeah.
Hmm. Hmm.
Yeah, and I just wanted to speak to that a little bit. Like if you're just doing very superficial work, it's unlikely that you're going to be causing any harm in first trimester. But the issue, I think, is more along the lines of having any kind of negative association between massage and a potential loss, right? And
Right.
so, yeah. Did
Yeah.
you want to
And
say
well,
something?
that's where that the myth comes in that massage can cause miscarriage, right? Like
Yeah.
that was the big thing when I went to massage school way back. And
Yeah.
so that's not necessarily the case, but because if, unfortunately something like that, if she were to miscarry and, you know, she's going to be wondering why, what happened. And if that's the only thing she can attribute it to, then we need to be cautious that that's not, she has no reason to think that that's what happened.
Yeah. So it's really a perception issue.
Correct. Yeah.
And that's not to say that we couldn't potentially,
Right.
do
I
some
mean,
harm if
it's
you were
not that
going
it's.
beyond superficial abdominal work. Like
Mhm.
that wouldn't be appropriate at all. But the caution of not doing any abdominal work in first trimester is more of an association um, issue than an actual safety precaution, right?
Right. Yeah. Yeah, absolutely. Yeah. And we want to the other thing that I think about is in first trimester, is this a woman who's had multiple miscarriages or really been
Yeah,
struggling to get pregnant for years, and
yeah.
so maybe, we put that early pregnancy off until she is 12 weeks if it's someone who really is at high risk.
Hmm.
Um, Yeah. And those women, I find like just intuitively, they tend to wait anyway.
Hmm.
But, and it's not that she can't get body work, right? I mean, there are plenty of things we could do to address it, but just some of those situations can fall into a little bit of a gray area and feel like
Yeah, and I think
better to, yeah,
I was gonna
err
say,
on the side of
I
caution.
yeah, and I was gonna say that as much as we want to have black and white, this is okay at this week, we have guidelines, right, that we work through, but there can be some gray area because each woman and each pregnancy can be so different. And so we have to really think through, you know, where is she at, where is she at, like chronologically in her pregnancy, where is she at, physically, are there high risk issues, what's her stress level, what are, there's a lot of things, what techniques would or would not be appropriate for pre-existing non-pregnancy related things that she's got going on. I mean, there's so many, and that's part of what makes this, an art and a science. It's not just, check all these boxes and, apply a pre-choreographed massage, right? So much of this is really critical thinking and listening to your client and figuring out what is going to be the most appropriate for her.
Yeah, absolutely.
And that's
Every
why
session is
having
different.
so many tools, like you're going to offer in your upcoming class, like 80 techniques for
Mhm.
pregnancy and labor and postpartum, it really gives you a lot to work with. Like all the students are going to leave feeling like I've got something for pretty much every scenario that's going to come across my plate, and then you can really kind of pick and choose what's going to make the most sense for the client in front of you.
Yeah, yeah, you get lots to choose from. And yeah, and you have tools to use for every situation. So
Yeah.
yeah.
Yeah, that's beautiful. And the other thing that I wanted to mention, because I think there was a comment, just like a comment under this event, I think from Margaret talking about how she still has a client who is lying on her belly at home, and that's not an issue at all, because what we're talking about is that potential for the intrauterine pressure, which a client wouldn't have that potential at home. That's going to come from the client, the the baby and the uterus getting sandwiched between two sets of pressure, namely a massage table, and then your hands is the second set of potential pressure. That's
Right.
not necessarily going to be something that she's going to be experiencing at home.
Yeah. Yeah. The weight of the therapist on top of the body is the issue. Yes. Yeah.
Yeah. So
Yeah.
Yeah, and so much of that, is like when you present that, clients will be like, oh yeah, that is a very different scenario. So then they might, instantly be like, great, let's try side lying. And then, when you get
Mhm.
them properly supported, they love it. I've had so many clients that just say this is the most comfortable that I have felt in my entire pregnancy, and it's just from getting them positioned correctly.
Yeah. I wanted to just maybe acknowledge really quick in case therapists, because I had a student one time who really pushed back about this, but the positioning system on the table with the hole, the
Hmm.
and we really discourage that because of the extra pressure it puts on the low back, the lumbar strain, and because not every belly fits in that hole, you really have no idea how much pressure she's getting and stuff. So I know some spas have those setups, and some
Yeah.
therapists think that they're great, but we really discourage from using those. And yeah, do you have anything to say about that?
Just that I will not use them in my practice.
Mm,
I
okay.
just won't. And I think a lot of it has to do with either therapists, excuse me, either clients like not knowing
Hmm.
why there's those potential concerns for safety, and also having also not a lot of confidence in what it is that we can provide them in sideline. If they're coming from an experience of like they got handed, a long body pillow and they have to kind of hold
Right.
themselves up and they're getting rolled onto their belly, then of course they're going to prefer to have a cutout pillow and,
Yeah.
actually be able to kind of relax their body. But yeah, all of those issues that you spoke to, you're creating more lordosis in the low back, you're compressing all of the discs, you're shortening all of the musculature that really needs to be lengthened.
Yeah.
And so, yeah, and like you said, we don't know how much pressure is being applied to the belly. So I will not use them. I have like a little visual and a very short, very kind of sweet explanation that we send to clients. That's still real friendly. That's still real like enthusiastic of like, don't worry, like this is gonna be great. We don't do this, but here's why, and here's what we can offer, and we promise like you're not gonna be disappointed in it. Um,
Yeah.
and it doesn't come up that much, but you're right, when it does, it's usually that person like they want what they want, and we're
Yeah.
not the practice for that. And I'm just speaking, to how I have chosen to set up my practice. We will not offer that.
Hmm.
Yeah.
Yeah, and it's okay to tell clients no, you
Yeah.
know.
Yeah, and again, like if they absolutely want it, that's okay. Like I'm happy to send them, to just say like we're not the right fit for you, and that's not, no hard
Right.
feelings. Yeah.
Yeah. Yeah. Yes, absolutely.
Yeah, and then I guess, something that we can circle back to again, probably in another live, is just that, you know, how equipped do you feel as a therapist if you do have a client that has a loss? And
Hmm.
do you specifically offer some kind of a bereavement massage? Do you welcome them back? Um, do you even have sort of an understanding and a set of language around how to support, a woman who's had a loss, or like you talked about, someone who perhaps has had multiple losses? So that's just something to think about, that we won't necessarily dive into today. But again, it's like you said, it's a circle, and it's pretty much going to be inevitable if you do this work long enough that you will have clients who are cycling through um,
Hmm.
different aspects of what can happen.
Yeah. Yeah, absolutely. Yeah, that would be a great conversation for another day.
Yeah, yeah, and I feel so fulfilled by the fact that we can really show up for clients who are grieving,
Hmm.
and who have the emotional and the physical pain, but then also sometimes like the insult of not knowing where to go and who is actually there for them. So
Right.
it's deeply fulfilling work to be able to show up for our clients who are navigating loss.
Yeah,
Yeah.
absolutely. Yeah.
Yeah. So I don't know if anyone has questions. Let me see. I didn't see anything in the comments. I know that there was a few people that had popped on. And yeah, we're at our time. So
I know
but
it goes really fast, right?
it does, but also it feels concise. It feels like a nice container, I think, to say everything or, most of what we want to say on a certain topic. So yeah, and then I forget what we're covering next week, but it will be something good.
So just really quick, Jane had made a comment, and maybe you acknowledge this, about her client insisting on laying face down. But I think we talked about that,
Yeah.
really educating them, and then just, sometimes they're not a good fit for our practice. But yeah,
Yeah.
yeah, cool.
Yeah, and if it's helpful, if you guys want, I'm happy to kind of send over what my practice sends to clients who ask that. Because again, we really kind of keep the tone like educational but light, and then we really almost everybody's like, oh, okay, great, that sounds good, and then we just book them, and that's that. But I wouldn't hesitate to also say if we might not be the right fit for you if there was a big gap between what their needs were and what we are actually comfortable and happy to provide.
Yeah. Yeah. That little bit of education goes really far. Women want to know what's going on with them.
Yeah,
And for some reason, they're just not getting a lot of knowledge, really evidence-based knowledge from places. And so
yeah,
we really need to do more of that. Yeah. So,
yeah,
and
and
the
it can be
treatment room is a great place to do it.
100%. Yeah, and it can be quite infantilizing to feel like she's an adult woman.
Yes.
Like give her the information and let her make her informed choices. Yeah.
Yeah, absolutely.
So yeah, awesome. Well, it's always so lovely to talk to you, Pamela. Thank you so much
Yeah, you
for
too, Sarah.
being
Yes.
here and for bringing the props, the amazing pelvis
Oh,
and
yeah,
Amy
yeah.
Cava made their
Yes.
debut. And yeah, for
Yeah.
anybody else watching, your next class is when?
So I have a class in Austin at the end of June, just a couple of weeks away. It's June 26th. I think that class is just about full, but I
Okay.
have a class in Cocoa Beach, August 3rd through 6th, and there's space in that class, and that's going to be so fun because we're just a couple blocks from the beach. I'm going to do it kind of retreat style.
Oh,
There's
nice.
there's 3 rooms in the house still available for people if they wanted to come and stay there. But we're going to do a little kayaking and a little mocktail charcuterie, and it'll be fun.
Oh, that sounds so fun. Well, I'm gonna start making
Yeah.
events for the actual courses that are coming up, just so that people are
Yeah.
aware. And yeah, so it sounds like you'll let me know if there's even one spot left in June, but if not, August.
Yes, I will let you know. That'd be, yeah,
Okay,
absolutely.
that's awesome. Yeah, and I'll put one up for my class that will be in November
When?
in San Diego.
November. Okay.
Yeah.
In San Diego. That's exciting. Okay, great.
Yeah. Yeah, it's
Oh
right in the marina, so it's beautiful. Yeah.
my gosh. I'm going to come see you someday.
I know. I want to go to Florida too.
Oh, please. Yeah. Yeah.
It would be
All
so
right.
fun.
Well,
So,
well, I'm
well,
excited to have the events in the group, so that'll be great.
yeah, just so people know that they're available if they need those
Yeah.
educational, touch points. So, yeah, great talking to you. Enjoy your weekend, and for everybody else watching, thank you so much for being here. And if there's anything that you feel like we left out, just drop them in the comments, and we'll be happy to answer. Or, always enjoy everybody else's feedback as well.
Yes. Looking forward to your comments. Yeah. All right. Happy weekend, you guys.
Bye.
Bye.